If you wake up with neck stiffness most mornings, if you experience unexplained headaches that seem worse when you first open your eyes, if you have noticed dizziness when getting out of bed, or if your arms or hands feel numb or tingly after sleeping, stay with me for the next several minutes because what I am about to reveal may explain symptoms you have been dismissing for years, and more importantly, could help you avoid a stroke that happens while you are completely unaware in your own bed. This is not about comfort. This is not about getting better sleep. This is about blood flow to your brain during the most vulnerable hours of your day, the hours when you cannot monitor yourself, the hours when warning signs go unnoticed, the hours when strokes silently occur in people who went to bed feeling perfectly fine. Let me make you a clear promise right now. By the end of this video, you will understand exactly how your pillow position affects blood flow to your brain. You will learn which sleeping positions seniors should avoid and why. You will know the warning signs that suggest your current sleep setup may be compromising your cerebral circulation. And you will have specific guidance on how to protect yourself every single night, not someday when you get around to it. Starting tonight, I am Dr. James Mitchell. For over 2 decades, I have treated patients recovering from strokes and worked to understand why some people suffer these devastating events while sleeping. One pattern I have observed repeatedly is how often stroke patients describe sleep habits and pillow arrangements that were quietly affecting their neck arteries for years before the event occurred. These are people who had no idea their pillow was part of the problem. People who slept the same way for decades, never knowing each night carried hidden risk. One of the most overlooked aspects of stroke prevention is what happens to your blood vessels while you sleep. During the day, you move constantly. You shift positions. You keep blood flowing through natural activity. But during sleep, you may remain in a single position for hours, a position that could be compressing or stretching the very arteries that feed your brain. And after age 60, when arteries become less flexible and more vulnerable, this becomes critically important. So now I want to ask you directly, how do you currently sleep? How many pillows do you use? Do you wake with neck pain or stiffness regularly? Do you ever wake with numbness in your arms or hands? Write your answer in the comment section below because understanding your current habits is the first step toward protecting yourself. And stroke prevention during sleep is something almost no one discusses until it is too late. Let me tell you about a patient named Harold. Harold was 67 years old and had always considered himself healthy. He controlled his blood pressure with medication. He walked regularly. He watched his diet reasonably well. He did everything he thought was necessary to prevent a stroke. But Harold had a sleep habit he never considered relevant to his health. He slept with 2 thick pillows stacked under his head because he found it more comfortable for watching television before falling asleep. He would drift off in this elevated position and often wake up with his neck bent at a sharp angle. He had morning headaches several times per week. He sometimes felt dizzy when first standing up. He occasionally noticed his left arm felt numb when he woke. Harold mentioned none of these things to his doctor because he assumed they were just normal parts of getting older. Stiff neck, morning headaches, occasional numbness. Everyone has those, right? One night, Harold had a stroke while sleeping. His wife found him in the morning confused and unable to move his right side properly. He survived but spent months in rehabilitation. When we reviewed everything that might have contributed to his stroke, his sleep position emerged as a likely factor. The way he had been sleeping was compressing his vertebral arteries night after night. His brain had been receiving reduced blood flow during sleep for years. And one night, a small clot that might have passed harmlessly through healthy arteries instead caused a blockage in vessels already compromised by chronic compression. Here is the question I want you to hold in your mind. Could your pillow be quietly setting the stage for a stroke? And would you even know if it was? The answer to this question might change everything about how you prepare for sleep tonight. To understand why pillow position matters so much, you need to understand the anatomy of blood flow to your brain. Your brain receives blood through 4 major arteries. 2 carotid arteries run up the front of your neck. 2 vertebral arteries run up through the bones of your spine in the back of your neck. These vertebral arteries are particularly vulnerable to positioning because they pass through small openings in your cervical vertebrae before entering your skull. When your neck is in a neutral position, these arteries flow freely. But when your neck is sharply flexed, bent forward or extended, bent backward or rotated, turned significantly to one side, the vertebral arteries can become stretched, kinked, or compressed. During the day, this is rarely a problem because you change positions constantly, but during sleep, you may maintain a compromising position for hours without any awareness. After age 60, this becomes increasingly dangerous for several reasons. First, your arteries become stiffer and less able to accommodate stretching or compression without reduced flow. Second, arterial plaque may have accumulated, making vessels narrower and more vulnerable to complete blockage. Third, blood pressure typically drops during sleep, which means any reduction in flow has more significant effects. Fourth, the body's ability to dissolve small clots diminishes with age, so a minor blockage that might have resolved at 40 may cause permanent damage at 70. Your pillow is not just about comfort. Your pillow determines neck position. Neck position determines arterial flow. And arterial flow during sleep determines whether your brain receives adequate oxygen for 8 hours every single night. Now let me walk you through the specific pillow positions that create the most danger and why each one threatens your cerebral circulation. The first dangerous position is sleeping with too many pillows stacking your head too high. When your head is elevated excessively, your neck flexes forward sharply. This forward flexion compresses the vertebral arteries and reduces blood flow to the posterior portion of your brain. The posterior brain controls vision, coordination, and many vital functions. Chronic compression can lead to cerebrovascular insufficiency, a condition where the back of your brain receives inadequate blood supply. Symptoms include dizziness, visual disturbances, difficulty with balance, and in severe cases, stroke affecting the brainstem or cerebellum. Many seniors stack multiple pillows because they have developed the habit over years. Some do it because of acid reflux and were told to elevate their head. Some do it because it feels comfortable initially without realizing the long-term consequences. Some do it simply because their old pillow flattened and they added another instead of replacing it. Whatever the reason, sleeping with your head elevated to the point where your chin approaches your chest is a position that restricts arterial flow night after night. The second dangerous position is sleeping with a pillow that is too flat, or with no pillow at all, allowing the head to extend backward. When your head falls backward, your neck hyperextends. This extension stretches the vertebral arteries and can also compress them against the bones of your spine. Sleeping flat on your back with an inadequate pillow allows gravity to pull your head into extension throughout the night. This position is particularly dangerous for seniors with any existing arterial narrowing or cervical spine degeneration. Some people abandon pillows because they heard it was more natural. Others use pillows that have compressed so much they provide almost no support. The result is hours of neck hyperextension during sleep, creating chronic stretch and compression of critical blood vessels. The third dangerous position is sleeping with your head rotated sharply to one side for extended periods. When your head is turned significantly to the left or right, the vertebral artery on the opposite side becomes stretched, while the artery on the turned side may become compressed. Stomach sleepers are particularly vulnerable to this because lying face down requires turning the head to breathe. Sleeping with your head rotated 90 degrees or more for hours dramatically reduces blood flow through one or both vertebral arteries. This rotation also affects the carotid arteries in the front of your neck. Extreme rotation can compress carotid vessels against the structures of the neck, further reducing blood supply to the brain. Seniors with any existing carotid plaque are at even higher risk because a narrowed artery tolerates compression much less than a healthy one. The fourth dangerous position is sleeping with your neck unsupported and allowed to bend laterally to one side. This happens commonly when side sleepers use a pillow that is too thin. The head drops toward the mattress, the neck bends sideways, and the vertebral arteries become asymmetrically stressed. One side is compressed while the other is stretched. This lateral bending also affects the intervertebral foramina, the openings where nerves exit the spine, potentially causing the arm numbness many people experience upon waking. Now I want to address something important that many people do not realize. The damage from poor sleep positioning is cumulative. One night of bad positioning is unlikely to cause a stroke, but years or decades of compressing your vertebral arteries during sleep creates chronic arterial stress. The vessel walls may become damaged. Plaque may form more readily in areas of turbulent flow. The arteries may become less able to dilate when needed. You are essentially training your blood vessels to malfunction by placing them under mechanical stress every single night. Let me tell you about another patient named Eleanor. Eleanor was 72 years old and came to me because she was experiencing episodes of dizziness and visual disturbances, particularly in the morning. She would wake up, stand up, and sometimes see spots or feel like the room was tilting. Her doctor had checked her blood pressure and found it normal. Her heart rhythm was normal. Standard tests showed nothing wrong. When I asked Eleanor about her sleep habits, she mentioned something that immediately caught my attention. She slept on her stomach and had done so her entire adult life. She used a single thin pillow and turned her head to the right every night, because that was the side facing away from the wall. She maintained this rotated position for 7 to 8 hours per night. I ordered imaging of Eleanor's vertebral arteries with her neck in neutral position and then in her typical sleep position. The difference was dramatic. In neutral position, her arteries flowed normally. In her rotated sleep position, the blood flow through her left vertebral artery decreased by nearly 40%. Eleanor had been reducing blood flow to part of her brain every single night for decades. Her morning symptoms were her brain telling her it had been oxygen deprived. She was having mini warning events that could eventually culminate in a full stroke if nothing changed. We worked with Eleanor to gradually transition to side sleeping with proper pillow support. Within weeks, her morning dizziness improved significantly. We may have prevented a stroke simply by changing how she slept. This brings me to a crucial point about warning signs. Your body often tells you when your sleep position is compromising blood flow, but the signals are easy to dismiss as normal aging. The first warning sign is waking with headaches, particularly in the back of your head or at the base of your skull. These headaches may indicate your posterior circulation was compromised during sleep. Many people take pain medication and move on without considering the cause. The second warning sign is dizziness or unsteadiness when first getting out of bed that improves as you move around. This suggests your brain was not receiving optimal blood flow during sleep and needs time to recover once you start moving and positions change. The third warning sign is neck pain or stiffness that is consistently present upon waking but improves throughout the day. This pattern suggests your neck was held in a stressful position during sleep, putting strain on both muscles and blood vessels. The fourth warning sign is numbness or tingling in your arms or hands upon waking. While this can have many causes, it often indicates nerve or vascular compression in the neck during sleep. The same positions that compress nerves may also compress arteries. The fifth warning sign is visual disturbances upon waking, such as blurred vision, spots, or brief episodes where part of your visual field seems affected. The visual cortex is supplied by the posterior circulation and is particularly sensitive to reduced vertebral artery flow. If you experience any of these symptoms regularly upon waking, you should take your sleep position seriously and discuss it with your healthcare provider. Now let me share what actually protects your brain during sleep. Understanding the dangerous positions is only half the solution. You need to know what to do instead. The safest sleeping position for cerebral blood flow is on your side with your neck in neutral alignment. Neutral alignment means your head is neither pushed up toward the ceiling by a pillow that is too thick, nor dropping toward the mattress from a pillow that is too thin. Your spine should form a straight line from your head through your neck and down your back. To achieve this position, you need a pillow that fills the space between your ear and the mattress without forcing your head higher or allowing it to drop lower. The exact pillow thickness needed depends on your shoulder width. People with broader shoulders need thicker pillows when side sleeping. People with narrower shoulders need thinner pillows. When lying on your side in a proper position, your nose should align with your sternum. If your face is angled toward the ceiling, your pillow is too thin. If your face is angled toward the mattress, your pillow is too thick. This simple alignment check can tell you whether your current pillow is appropriate. Back sleeping can also be safe if done correctly. When sleeping on your back, you need a pillow that supports the natural curve of your cervical spine without forcing your head forward or allowing it to fall backward. A pillow that is too thick pushes your chin toward your chest. A pillow that is too flat allows your head to extend backward. The correct pillow for back sleeping is typically thinner than for side sleeping, but must still maintain neck curve support. A useful test for back sleeping position is whether you can swallow easily while lying on your pillow. If your head is flexed too far forward, swallowing becomes difficult. If you cannot swallow comfortably on your pillow while lying on your back, the pillow is likely compressing your neck structures, including your blood vessels. Stomach sleeping is the position I recommend avoiding entirely after age 60. There is no good way to stomach sleep without rotating your head significantly. This rotation compresses vertebral arteries and creates all the risks I described earlier. If you have been a lifelong stomach sleeper, the transition may be difficult, but the protection it provides for your brain is worth the adjustment period. Let me share several practical strategies for improving your sleep position. The first strategy is pillow replacement and proper selection. Most pillows lose their support within 2 to 3 years. If your pillow is older than this, it is likely no longer providing the support it once did. When selecting a new pillow, consider your primary sleep position. Side sleepers need thicker, firmer pillows. Back sleepers need medium thickness with good neck curve support. Do not choose a pillow based on how it feels in the store for 30 seconds. Consider how it will perform for 8 hours. The second strategy is using a cervical pillow specifically designed to support neck curvature. These pillows have a raised edge to support the neck while the center is lower to cradle the head. They help maintain neutral alignment for both back and side sleepers. Many people find them uncomfortable initially because they are different from traditional pillows, but adjustment typically occurs within 1 to 2 weeks. The third strategy is using body pillows or additional support to discourage rolling into dangerous positions. If you tend to roll onto your stomach during sleep, placing a body pillow against your front can help keep you on your side. Some people place pillows behind their back to prevent rolling that direction. These physical barriers can train your body to stay in safer positions. The fourth strategy is gradual transition if you need to change your habitual position. Do not expect to go from lifelong stomach sleeping to perfect side sleeping overnight. Your body has muscle memory and will try to return to familiar positions. Transition gradually. Use physical barriers. Be patient. The goal is long-term change, not immediate perfection. The fifth strategy is addressing underlying conditions that affect sleep position. If you stack pillows because of acid reflux, consider elevating the entire head of your bed rather than just your head. Using bed risers or a wedge under your mattress can reduce reflux without creating the neck flexion that stacked pillows cause. If you use certain positions because of pain, address the pain source rather than compensating with dangerous positioning. Let me tell you about one more patient. A woman named Patricia came to me at 70 years old after experiencing what her doctor suspected was a transient ischemic attack, sometimes called a mini-stroke. She had experienced sudden dizziness, confusion, and weakness that resolved within an hour. Patricia was understandably terrified. She wanted to know what caused this event and how to prevent a full stroke. When we reviewed her risk factors, her sleep habits emerged as a significant concern. Patricia slept on her back with 3 pillows elevating her head because she found it easier to breathe. She had developed this habit after gaining weight and noticing she snored less when elevated. Imaging showed Patricia had moderate narrowing in one of her vertebral arteries, likely from years of atherosclerosis. Her sleep position with extreme head elevation was compressing blood flow through this already compromised artery every night. We worked with Patricia on a comprehensive approach. We addressed her weight. We evaluated her for sleep apnea, which turned out to be present. We got her fitted with a proper treatment for the apnea, which eliminated her need for excessive elevation. We transitioned her to a single appropriate pillow for back sleeping. Patricia has not had another event in the 3 years since. We cannot prove her pillow position caused her TIA, but we can recognize it was a contributing factor that has now been eliminated. This is the nature of stroke prevention. Rarely is there a single cause. Usually multiple factors combine. Blood pressure, blood sugar, cholesterol, inflammation, arterial stiffness, and yes, sleep position all contribute to risk. Addressing each factor reduces overall danger. Ignoring any factor leaves unnecessary risk on the table. Your pillow position may seem like a small thing compared to blood pressure medication or cholesterol management, but it is a factor you control completely. It is something you can change tonight. And over years of sleep, it may matter more than you imagine. For the next 2 weeks, I want you to evaluate your sleep position consciously. When you go to bed, notice how your neck feels. When you wake, notice your symptoms. Check whether your head is in neutral alignment. Notice whether you have been rotating your neck. Notice whether you wake with any of the warning signs I described. If you identify problems, take action. Replace your pillow. Adjust your position. Use barriers to prevent dangerous rolling. Consider a cervical support pillow. Talk to your doctor about any persistent warning symptoms. Sleep should be restorative, not destructive. Your brain should receive optimal blood flow during sleep, not reduced supply from compressed arteries. Every night of proper positioning protects your brain. Every night of poor positioning adds to cumulative risk. Anyone who tells you pillow position does not matter, for stroke risk is not aware of the research on vertebral artery compression during sleep. Anyone who tells you that only blood pressure and cholesterol matter is missing a significant piece of the prevention picture. Sleep position is a real factor. It deserves real attention. I have spent my career helping people understand hidden health risks. Your pillow position is one of those hidden risks that most people never consider until something goes wrong. You now have the knowledge to protect yourself. The question is whether you will act on it. Your brain deserves better than compromised blood flow every night. Your arteries deserve better than chronic compression during sleep. Your future deserves better than a preventable stroke. The changes are simple, the protection is significant, and the time to start is not when you get around to buying a new pillow. The time is tonight.